Improving patient experiences. Patients make healthcare decisions based on what we do and how we do it. The employees and clinicians of ISJ Regional Medical Center believe that the needs of the patient come first, and whenever possible, we use the voice of the customer to see how well we are meeting our patient needs. Surveys, focus groups, calls, and letters are tools we use to better understand how patients and families judge their overall healthcare experience with us.
Our patients have told us that one of their main goals is that we treat them as if they're the only patient that we have at that time. They want to know that they're important, that we're going to take care of them, that we're going to listen to them. And so when they talk about their concerns, it's really them asking, are we going to listen to them? Are we going to pay attention to what they have to say? You know, as the patient experience manager, I get a lot of patients sharing their concerns, and one of the things I've been able to do is just really be a listening ear. The greatest thing about our patients is they tell us. They're not afraid. One of the main tools that we use to get patient feedback is our patient satisfaction survey, and we monitor those closely, and each department has the opportunity to look at those and learn from the actual voice of the patients. One of the things the surveys show us and tell us is that our patients find our nursing staff very friendly, very courteous, and that's something obviously they would desire. And same thing with our providers. They find our providers very caring, and that makes sense because patients wouldn't want to go. People wouldn't want to go where they didn't feel like we were friendly or that we didn't care about them. We care for them. We treat them as people and not as numbers or patient number 1, 2, and 3.
I was out of state for the first part of my treatment. It was good to come home for rehabilitation. I really like my therapist, Craig. He worked me hard, but we have fun too. Cody Olson, Springfield Medical Center physical therapy patient. Patients have told us that Ginger Krings, a nurse at ISJ Specialty Clinic in Mankato, provides excellent nursing care on a consistent basis.
For me, my patients are my top priority in my day. They're my number one thing I do. If I have paperwork, anything else going on, I make sure I'm dealing with them first. I listen to them, find out their concern, and then kind of step in and play the right role I need to play for them.
All of the staff was so friendly. On the first day, the entire team came into my room and introduced themselves. The doctor, social worker, dietitian, and nurses. Everyone was so pleasant, and my treatment was excellent. Joyce Pribble, Waseca Medical Center Transitional Rehabilitation Unit patient.
When my patients come to me, I always try to give them a trustworthy answer, to know I'm a reference for them, to know they can be comfortable and open and honest with me. For me, the big thing is education. I educate them, and then also, and that helps them make the right decision. And hopefully they don't make the decision we want, they decide on the actual decision that they would like to go with.
The family's experience affects a patient's experience. Having most of her care close to home definitely made my mother's recovery easier, and it's a nice place to be. We were very impressed with the new facility and with the people. She called the night nurses her guardian angels. Now she runs into them outside the hospital, and they give her big hugs. She made friends with everybody, and they became like family. Jill, daughter of Marlene Camlighter, St. James Medical Center swing bed patient.
When the patients are vulnerable, then the families are vulnerable as well. And so we have to take into consideration that whenever a patient is sick or has concerns, that the family's going to be informed. But we also want the families to know that if they leave, go eat dinner or whatever, that we're going to take care of their patient. They're going to take care of their loved one, their family member, because that's a big concern. Otherwise, they're going to stay around, they're nervous. We haven't put them at ease. And so we want to have a calming effect on the patient and the family.
The hospital was extremely accommodating, not only by providing a healing environment for Corinne, but for working with us and her close friends to provide the comfort and support she needed. What happened at Emmanuel St. Joseph's throughout the system is that people went out of their way to determine what Corinne needed, what we needed as a family, and what her friends needed. We were so impressed. Denise Overstake, mother of Corinne, Emmanuel St. Joseph's ICU patient. When concerns come up, accountability is important.
One of the great things about working at Emmanuel St. Joseph's is the point of accountability, and really allowing each department to handle their own concerns that are raised. And so we allow our managers, we really desire to see our front staff handle any concern that comes their way. We try to empower them to talk to the patient right there and not ship them off to another department, but say, I'm responsible for taking care of you, and we're going to try and make things right as close to the situation as possible.
And I think it helps too when that department specifically calls that person, because then they feel like they do care instead of having Sean call. It makes a difference if someone directly from that area calls them too and acknowledges that they were upset.
I've had a patient that he came in, he was upset in the morning. I talked to him and he realized he hadn't eaten yet. And I was able to give him a gift card, and he was able to go out and get a bite to eat. And he was very thankful for that. Thankful for the time, but also understanding that we know it can be an inconvenience for them to make extra trips. And one of the things you learn is that unless you ask the right questions, you're not going to get the right answers. You're not going to know what they want.
To contact ISJ Regional Medical Center with questions or comments about an experience, please call 507-381-5252.